Okay, welcome. Oh, so many of you are joining us today, and we are so grateful. Um, right now, we're at about 55 participants, and people are still coming in. I'm going to kick things off. I'll introduce myself. My name is Marguerite Pierce. I will be acting as the moderator. I'm also one of the co-founders of She Matters. So I'll just remind people of a little bit of housekeeping items. Um, First and foremost, as you already noticed when you join the Zoom, everybody's on mute. There's a large number of us participating, and that's just to keep background noise down. Um, the camera, whether or not you're on camera, that's completely at your discretion. We would love to see your face, but no pressure. Um, Additionally, please remember that the topic is a sensitive one and the subject matter may be triggering. So I'm going to post some information. If you're feeling overwhelmed, you can reach out to a hotline for support, and I'll post that in the chat momentarily. For the Q&A portion of today's event, I will ask that everybody submit their questions to me, the host, and I will read them for our guest speakers and our founder, Jade, to answer. It's just easier to manage that way. And I think that's about it. So I will turn things over to Jade. You're on mute. Hang on.
Hi, everybody. Good morning or good afternoon, depending on where you are. I'm so glad so many of you are on today. Again, my name is Jade Kearney. I am the CEO and founder of She Matters. Some of you may have attended our other installments of this three-part series, and so you may know a little bit about why She Matters came to be. So I'll just give you a little summary. I started She Matters because I experienced something called postpartum anxiety OCD. And what that is basically anxiety during your postpartum period, more so than like the normal amount of anxiety. I had something called intrusive thoughts, so unwanted thoughts about harming my daughter. I would check her like hundreds of times throughout the night to make sure that she was breathing. I think we all check for SIDS. It's something that is just in the media, like we're scared of, right? But I was doing it overwhelmingly, like hundreds of times. I couldn't sleep. And just like my normal thought pattern, like I was always anxious. I was always thinking about like, what's wrong with me? What's gonna happen to her? What's gonna happen to me? And so I decided to reach out to family members, but you know how we are. So I'll let you know how my family is. When I told my family I was struggling, they were all, girl, you can make it. You'll be okay. This is part of it. And it was kind of, to me, I felt like shrugged off. I was literally suffering and I couldn't communicate that well. So it was important to me that other Black women, especially due to our culture, that we had a community of women we can talk to when we are experiencing these type of postpartum mental illness or extreme stressors. Also, I couldn't find resources. So I was looking diligently to figure out where can I go to figure out what's going on with me. Because in the beginning, I didn't really know what I was experiencing when I was experiencing it. I had no idea. I was like, I know something's wrong. I know it's not right, but I'm not exactly sure. I just can't like get myself together. So I looked for resources online and I found a lot of resources geared towards postpartum depression. But I didn't find anything really for anxiety. I kept digging. Eventually I found something. But one thing I realized immediately was none of the women on those forums looked like me. There were no Black women. Culturally, things were just off. And I found one article, and I'll say this forever. It was a BuzzFeed article, and it was 10 women giving their personal experiences. And I really think that article saved my life. It really helped me understand that I wasn't the only person going through this. I wasn't the only Black woman going through this, right? There were other Black women who were experiencing what I was experiencing, right? But that was one article. So then I started to look for a therapist, because at this point I became somewhat desperate, right? And it took a while for me to find the right therapist. I felt like some therapists weren't culturally competent, meaning they didn't know about like the Black experience and Black life. And I was talking to them and it was like, we were missing each other, right? Like just because they didn't understand who I was as a Black woman. So I started She Matters because I want to make sure that none of you experience what I experienced, which was a lack of community, a lack of resources, and a lack of culturally competent therapists. So today our topic is medication. And this is near and dear to my heart because I know that as Black women, when it comes to mental health, there are a lot of barriers before we identify with what we're going through. For me, I had a lot of barriers. I knew I had anxiety before my baby, but after I had my daughter, my anxiety really, like I said, went up. I couldn't function. And the first thing doctors said to me was, here's medication. And whenever a doctor gives me medication, I'm like, hold on, let me look at these side effects. This doesn't look right. Let me go the natural route. So I tried everything. I tried herbs. I tried like different types of therapies, and I still wasn't feeling like this is helping. It's helping, but it's not changing the way I feel. I'm still not feeling like myself. Granted, there's a period of time after you have a baby where you don't feel like yourself, but I really wasn't feeling like myself. I wasn't comfortable in my own skin. And so I told my doctor, hey, I'll try it. I'll try medication for, it was like an antidepressant. I went to my aunt's house. I went to my auntie's house and I told her what I was about to take. And she flushed it down the toilet. So this was pivotal for me because she didn't offer me like any other help. She was just like, girl, you're not about to act white and take this medication. Like, this is crazy. What if something happens to you? What if you're not yourself? And she just took it and she flushed it down the toilet. And I remember feeling like, yeah, I'm not supposed to be doing this. This is actually a bad thing. Medication for your brain, for anxiety or for depression is bad because it's telling you that you're weak. I just felt weak, right? I felt like, oh my God, like, why can't I get past this? My mom has 8 kids. My grandma had 5. I should be able to deal with this. I should be able to cope. I don't need no medication. So I spoke to my best friend, who was also the co-founder of She Matters, and I told her I was going to give myself a year. I gave myself a year of no medication and did every kind of alternative therapy. I went to Ayurvedic medicine, which is an Indian type of medicine. I went to acupuncture. I went to meditation. I went to mommy's groups. I took herbs. I lost weight. I did everything. And during this time, I was on, the doctor gave me a medication for anxiety. So it was like Xanax, right? So the doctor said, when you're feeling anxious, take this medication. I felt like that was a quick fix. Like at my daughter's first birthday, I'll never forget feeling like I'm still not right. Like something is still wrong. I'm not feeling like myself. Like, and I was telling my fiance, like, I'm still struggling. I was still crying, and I wasn't crying because I felt like the medicine wasn't working. I was crying because I missed feeling like myself. Like I legit felt like, yo, I'm just experiencing this motherhood, but like I'm watching it. I'm not living it. And that was sign enough for me to speak to another one of my best friends who just happens to be a psychiatrist. Look how God has set me up, right? And I was like, something's not right. I'm feeling like things are wrong. Like I'm having these intrusive thoughts. Like I can't process what's happening to me. And I'm making it. I'm going to work. I'm breastfeeding. I'm pumping. I'm having the birthday party. I'm having the family over. I'm doing all of these things, but I'm not feeling well. My fiance's family is from the Caribbean, and I remember his cousin coming, and we had like an event, and she's an amazing chef. And I told her what I was experiencing, and I remember her saying to me, "Girl, I went through that. You get way, way down deep in your thoughts, but you just gotta push through. Like It's going to take a while, but you just got to push through. And I felt, the type of person that I am, I felt like you don't just have to push through. There has to be some type of solution to what you're experiencing. I can't just go around feeling like this for the rest of my life. So I spoke to Dr. Poole, who was also my very good friend, and she said, you may need some medication. You might need something to help you right now. And I said, no, I don't want to be weak. What if the side effects? Oh my God, the side effects. I thought, what if I die? One of the side effects is suicide, right? And they put that on the bottle, but they don't really explain what that means. So I was like, I'm about to take this white man's medicine and I'm about to die because I can't cope because I'm weak. And that was really my thought process. And she told me, how are you experiencing life right now? And I was like, I wasn't living, right? She said, why don't you try it? Get a psychiatrist that you trust and just see how you feel. So that's what I did. So I started taking the medication. I was lucky enough, and I would encourage all of you to do this, to have a conversation. The first thing that doctors tried to put me on was something called Zoloft, and most of us have heard a commercial about what that is. That's not what I'm on. I'm on something called Luvox, and we have medical professionals on the call to talk about what that is. But when I first started taking it, I felt like I was waiting for something to happen, right? Like, ooh, what's gonna happen here? Is my toe gonna blow up? I don't know, just like, cause they were like, your feet will tingle, or am I gonna throw up? Am I gonna not feel like myself? Am I gonna be a zombie? And there were some side effects, but the side effects were like, I'm really tired and I have a headache. And after about 6 weeks, I didn't feel any of that, but I felt better. I'll tell you that, I felt better. I saw some glimpse of the light at the end of the tunnel. And I thought to myself, oh my God, I could have been on this a year ago. I took all of this time thinking, like, beating myself up as a Black woman, because I felt like if I did this, I would be weak. I wouldn't be doing what other women before me did. Like, it was almost like self-imposed suffering, right? There was also fear there. I had a lot of fear because I didn't know what would happen, because I didn't have other Black women that I could speak to about what I was experiencing, because none of them had ever been on anything. So what I did do was I reached out to somebody I used to work with, a former boss of mine, and she's not Black. And I told her right before I got on the medication what I was experiencing. And she said, oh, there was a period of time I was on something for 4 years, an antidepressant, because I didn't feel like myself. Try it. If you don't like it, get off of it. And that was the first time a woman had told me it was okay. And she wasn't Black. And I said, no, we have to create a space where if that's where you are in your life, it's okay. And you don't have to beat yourself up about it. You don't have to go and ask 200 people like I did. You don't have to look for constant validation about your feelings. The medication, and now this is what I say before I turn it over to our physician's assistant, amongst many other things. I always say the blood pressure medication our family takes, the diabetes medication our family takes, the high cholesterol medication our family takes, is from the same manufacturers that antidepressants are. So I really hope some of this helps you, because this is what I needed, but I definitely felt like it was important to have a topic on medication and to share my story. And with that, I'm going to turn it over to I'm going to turn it back to Marge. Go ahead. Sorry, Marge.
You're good. Just intro Sandy. Like,
Okay.
you're on point.
Hi, everyone. This is Sandra McKenzie, and she's going to talk to us about a couple things, but some alternatives to like Western traditional medication.
Hello, everyone. Good afternoon. My name is Sandra McKenzie. I'm actually a physician assistant, but in the more in the integrative space. I'm also a certified personal trainer, nutritional consultant. I do a lot of different things. But one of the things I heard Jade's story is amazing, and she's definitely on point with making sure that you come to a lot of these conclusions and not feel scared to reach out, because all of these therapies are definitely available. And there's a stigma that we have as in African American culture, and particularly I'm West Indian, is that you don't, if there's any mental health issues do not exist. They are, if you say that you're feeling depressed, or if you say that you're hearing voices, they'll just tell you to snap out of it. There's no such thing as anyone in the family having bipolar or schizophrenia. It's almost like if someone says you do, then you're the talk of the town, and it's a terrible thing. So it's good that we are having this conversation. But I'm going to definitely switch it into more of the integrative space with the time I have, in saying that there's that component of making sure that you do have that conversation, and medication is definitely something available. However, you definitely want to make sure that it depends on the health that you're in. You want to make sure that, like Jade has done, in checking the boxes to make sure there's no nutrient deficiencies. You want to make sure that your thyroid function is on point, because when you're having kids, when you're in a pregnancy state, a lot of your hormones are railing out of control, and some things are thrown off, and a lot of times it's environmental. So you definitely want to make sure that you have a thyroid check, and your vitamins and minerals are where they should be. So you consult with your doctor, make sure they know if there's any anemia. It's very simple things that you may need to replace, um, uh, you know, because of the fact that you are having a baby. The other thing to consider, and it's a big, big piece in mental health, is your circadian. So what happens is, even before, if your sleep was a little bit off, by the time you have kids, your sleep is really off. And your circadian clock speaks to your health. So if you know that you've been getting to bed at a certain time every night, and that's thrown off, and it will be with a baby, you're definitely going to have some kind of anxiety. If your rhythm is off, when your rhythm is not is off, then these other things will come into play. So along with making sure that you are having that conversation, is to make sure that you're looking at what you can do in your own space to try to get back to some kind of normalcy, even with the baby. And I know, because I have two kids, as a single parent, and they're big now. But I went into that space particularly when I had my first daughter, and what I did was I worked out with her. I made sure I was even more healthy by the time I had her, because when you exercise, it increases serotonin to the brain. So there's a lot of different things you may have to put in there that would be just like medicine. You may learn some new things that you hadn't done before you had a baby, because these other things is actually like taking a medication. If you can increase serotonin, is something that fits into the receptors of the brain and makes you feel good. It's something that when you even take certain medications, it increases serotonin to the brain. So you definitely want to see if you can do that naturally. The other thing is making sure that you're eating in a better way, because it will definitely stimulate the brain to work better. Um, so that's the space that I'm in looking at those parameters as well as supplements. So we talked about deficiencies. There are different things that can help with, if you're feeling tired, to make sure that you're not burning your adrenals out because you're taking care of that baby and baby's up all night. So there are nice things that we have called adaptogens that work with your adrenals. There are things natural you can take to help you with your thyroid. There are things that can help you with brain function. There's things that can help you get to bed, like melatonin. So definitely, along with what you take with medication, you want to have a conversation with someone about natural remedies that can complement what you do in your own space, that you can take yourself and do, and then work with medication. Going to medication is something, as Jade mentions, is a journey. So right, she looked at all of these other parameters, and then she knew that this was the final. And that's why she's able to have a breakthrough in taking medication. It's if you just go directly to medication and you haven't changed some of those other things and looked into those other things, it becomes just a Band-Aid. It may work, but it's that once you peel it, those other layers are still there. So you definitely want to make sure you get into that healthy space, do all of those things, get your exercise in, and then you can say, okay, my there's no anemia, my thyroid's good, I'm doing these other things. Why am I still here? And then you can now say, okay, now is a good time for me to have that conversation more about taking some kind of medication to help get that serotonin to, where it needs to be. And so definitely it's a time that it's never going to really go back. You always have the kids, and, when you have children, your life will change, as well as your anxiety. I don't care what anyone says. You have kids, people. I used to say, I remember when my kids were little, and I would have a conversation with people because I do different empowerment events to make myself even feel better. That it's really a shame that if you you sit on a bench with your child and you sit next to someone else, and that you ask that person, how are you feeling? And they say, oh, I feel wonderful. I mean, my baby is the best thing in the world. And I mean, it's changed my life completely. I'm a new person. And they ask you how you feel, and you're honest, and they're automatically thinking you're a bad parent. If you tell them, oh, man, I don't know what happened to me. Like, I love my child, but I feel like I'm just not myself. I can't even function. The first thing is like, even that parent is looking at you like, what's wrong with her? Like, why is she, how dare her feel like this? Look at this beautiful baby that they have. And it's not that you don't think the baby's beautiful, but you're still here too. So you're here, they're here. You still don't want to lose yourself. So you want to make sure that you do reach into She Matters, and you reach into making sure you are utilizing the resources, because you're still here and it's normal. You have baby, it's normal to feel the way you feel. There's so many different layers of not getting the rest, whatever the condition. Most of us are anxious before we even have kids. We've got an environment that we're trying to get buy-in, and then we have kids and it just turns everything in the other direction. But definitely make sure that you utilize the resources that are available to you, and just know that it's a journey, but there's definitely that light at the end of the tunnel when you utilize the resources. Take a look at what you're doing in your own space. Make sure that you're consulting in the integrated space, and then you're looking at the other alternatives. You have to put everything together. It's not just one thing that gets you through.
Can I add something, Sandy?
Sure.
So just to piggyback off what Sandy is saying, like exercise, your diet, supplements, all of those things go into figuring out what's going on with you. And all of those things are self-care, right? Like, for me, self-care was like getting my hair and my nails done. I'm just gonna be honest, like, oh, this is self-care. But really, self-care is really taking care of your body and your mind. So those steps that Sandy's talking about when she's saying create a space for yourself, like, I know that it's hard, because when you're a mom and you're a partner maybe, or even if you're a single mom, how do you create the time to create the space for yourself? But if you can exercise, try to eat right. So I always say this because our foods are different, and Sandy has taught me how to eat better, right? You don't have to eat a salad every day, but you probably shouldn't eat certain foods every single day that you know aren't making you feel good. That'll add to it. And then you have the supplements. I had no idea, and Sandy taught me this as well, that you can go to the store and get something like magnesium and it not be the right one to make your brain feel better. Or you can get a vitamin D supplement, and that supplement is not really helping. It's not, Sandy, you want to add to that just about the supplements before we go to Colette?
Oh, yeah, absolutely. So We know that the integrative space, functional space, and supplements is not regulated, and what that means is they can just put anything in these pills. There's no FDA and all of these things you've heard of when you're taking pharmaceutical medications. They're regulated. They have to go through certain phases of testing, but these supplements that they have in the stores are not all the same. So there's something called medical grade supplements that you can get from an integrative provider. Even, I prescribe those, but there are different types of magnesium. So where you say that, let's take magnesium really quick, for example. If you have an issue, many patients will come into me and they tell me that they have a headache and constipation. I know that most of the time it's a magnesium deficiency, but what type of magnesium? So for them, because of headache and constipation, it would be magnesium citrate. If I know that they're having an issue with brain function, then it may be magnesium threonate. There are different types of magnesium, different molecules. Some will have you going to the bathroom more often than you need to go. You may not have an issue with constipation. So this is definitely a conversation that you would want to have with someone in the integrative space. But just know that even if somebody or your friend tells you, oh, get this supplement from here and get this supplement over here, it's not the same. And it may be that if you get it from an integrative space or integrative provider, it's medicine. So I use supplements to treat. I use supplements for high blood pressure, diabetes, and they're medical grade supplements. They're not the ones that you can just go to GNC and get them and take them, because we know that a lot of the stuff in them are junk. But definitely you want to supplement, you want to exercise. Food is important. It's not just how much you're eating, but what you're eating, as Jade mentioned. What kind of beef are you eating? What kind of chicken? We get a little bit deeper in that once you get the basics in. And you will feel a lot better once you can get your body to heal itself or to generate its natural nutrients without having to supplement in another way outside of the box of letting your body heal itself. And I think that's very important in the road to even feeling better anyway.
Sandy, can you just tell everybody before we go to Colette, what does integrative mean as opposed to like your regular doctor?
Yeah, I'm so sorry. I'm always but with integrative, just if I can say it very simply, it's prevention in my mind. It's looking at how we can use our body and natural resources to heal ourselves. It would be that if you are in an environment that has a lot of toxins and you have issues with your lungs and other things, one of our pieces of conversation with you and I would be, maybe you should move. So integrative functional is taking a look at how you can change factors going on within yourself. And a lot of it is environmental. And so we have to make sure that we are first removing these other things that we can remove them. So we look at how you are going to make your body work in the best way. If you have an issue with your lungs, and we know, okay, I'm not going to get too far beyond, but if where we are right now is what we call sea level, 100% oxygen. If you tell me you have COPD from something and you live up in the mountains and you have COPD that has less oxygen than 100% being down here where we live, I'm going to tell you, you can do everything in your power. You can go on all kinds of Advair and oxygen, but if you move down to where there's 100% oxygen, where you're at 80% where you live, come down from the mountains. That's the first thing I'm going to tell you. Move down from the mountains, get to the 100% oxygen, and let's take it from there. It's the same thing with what's going on with what, I guess in a nutshell, I say with postpartum depression. Get yourself away, into a different environmental space, and then take it from there. So that means that you've got to look at the things around you. You've got to look at what you're eating. You've got to look at if you're exercising. You have to look at making sure that you have some kind of mental space with your spouse, making sure that you know how to communicate, making sure that you're getting all of these things as much as you can together, and then take it from there. Because anything else you do outside of that, even if I gave you a supplement and you lived up in the mountains, it's still a Band-Aid. So get your mental space, get yourself in that circle, in that circadian, and then, hey, things are still maybe off, but at least you know that you have changed what you can environmentally. You're exercising, you're doing all of these other things, and hey, let me go now and have this medication conversation. But that's what integrative is getting to the core of what's going on with you, without saying that I have a toothache, here's medicine. I have this, here's this for that. It's finding out why these things are going on, and then let's see how we can work with those things before we have to go to the next step, which is medication, supplements, and all of those other things.
But if you do have to take medication, I'm going to introduce, thank you so much, Sandy. I'm going to introduce Dr. Colette Poole.
Hello, everybody. I am an adult and child psychiatrist by training, and I'm practicing at Yale University. And I have really enjoyed being a part of this series, and I'm just so grateful for Jade and for Marge. Like, they're just two phenomenal women who came up with this concept, because we have to really take matters into our own hands and be advocates for ourselves, and a part of that is learning. So with that said, thank you so much, Sandy, as well. And I kind of have an integrative approach to my style of medicine. Integrative by meaning I consider other aspects other than like labs and like just who and what you are biologically. I consider the social aspects as well as the psychological aspects before I put together a treatment plan. And actually, I put together a treatment plan that'll mitigate, which means decrease your risks in each of those categories, which is why I take so much time when I'm doing a patient's history. So I don't know if you guys can see this. I hope you can. This is like a Venn diagram showing the biopsychosocial model that I've talked about with you all before. Whenever I talk to a patient, I split things up when I make my assessment, and I say, this is how this patient is biologically. And that would mean like your physical health, neurochemistry, your genetics, who your parents are, what they had, what they didn't have, other metabolic disorders, immune response, stress response. So that would be a biological part, right? And then there's the social and environmental. That would be like who your peer group is, work, school, your culture, family circumstances, interpersonal relationships. That would be your social environment. I consider those things as well. And then lastly, psychological, that would be like your response to rewards, your emotion, your temperament, your perception. All of these are important when you're picking and choosing treatment plans. And so I put together treatment plans that help. So sometimes it could be a supplement, sometimes it could be therapy, and then sometimes it could be a medication. Okay, so what I want to talk about is how I recognized that as Jade was talking to me that she was gonna need medication. So me and Jade go way, 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 way back, but she was at the point where her mental state was impairing her functioning. She was not sleeping. She was not able to be who she wanted to be. And first, Jade needed permission to like feel better. As Black women, a lot of times we need that because sometimes we feel like suffering is just a part of our makeup and we just have to do it. And if I'm not suffering, then I'm not doing it right. And I'm like, Jade, I don't know if you remember, I was like, Jade, you have to like want to feel better and tell yourself that you deserve to feel normal. And then from there, it was like, okay, now where are we here? And she was still having difficulty functioning. Because there's sometimes you will not be able to understand what's going on in therapy. You could have the world's greatest therapist. You could have the world's greatest medical grade supplement. But if your body is not manufacturing enough serotonin, neuroepinephrine, dopamine, and modulating it well, none of that stuff is going to work. So sometimes especially when I'm working with kids, I'll tell a parent, this is not going to be a wonder drug. I'm telling you, this is going to work for a couple of weeks, but then this child's behaviors, that social and psychological stuff is going to overpower the biological. So what we're going to do is we're going to give you this medication. And then what I expect is for you to start employing some good behavioral things and changes in your life with your child as well. So that way, this biological change will help the social change to stick. You see what I'm saying? So sometimes we do need the biological portion to be corrected. So this could be easily understood by thinking about your hierarchy of needs. That means if you're looking like at a pyramid, the thing on the bottom is the thing you need the most, your foundation. So it doesn't matter how philosophical someone is. If you are hungry, you're not hearing them, right? And so that's what I'm saying by taking care of that biological thing. So Jade in a sense was hungry, and her body was hungry for something, and she had to figure out what it was for her to be able to indulge and get something from the therapy. And then from starting on the medication, from regulating her serotonin, dopamine, and neuroepinephrine, she was able to take advantage of everything else, all the other resources that she had. Let me quickly explain, and this is how I can explain this even to kids, and it's like the kids are like, oh, like the lights are going off. So serotonin, I call, like, that is the like, I'm content neurochemical. That's a chemical in your body where it's like, all right, I'm cool. Like, I'm not like crazy happy, I'm not crazy sad, I'm like cool, I'm mellow, I'm cool. That's what the serotonin is, right? Neuroepinephrine is like if you've seen a movie, a war movie, and somebody's on the field and they just like, they have a needle and they're like, I need epi, and then they give it to the person is like, like you seen that? Or those episodes on like those doctor shows and they're like, epi, because they're trying to like increase and arouse your system. So that is that like hyper arousal chemical. Okay, so we have serotonin, our content chemical. We have the neuroepinephrine, that's like excitability, hyper arousal, you're arousing your system. And then we have dopamine. Dopamine is that reward chemical, like, okay, I did a great job, I feel good about it, so I'm great. So when I talk to patients, sometimes I break it down to them, and I have like medication charts and things that I work with them. And I'm like, okay, where are you feeling lacking? So after I get that bio, psycho, and social, I figure out, okay, what's going on? And they'll tell me, I don't have any motivation. Like, I had a patient who wouldn't get out of bed. She wouldn't even change her pads, like when she was on her period. And her mom had to like make her change her pads. To me, it's very clear that she needs, can you guys like put in a comment, out of all of those, the serotonin, the dopamine, and the neuroepinephrine, remember, serotonin, content, dopamine, reward, neuroepinephrine is that like arousal. What do you think this girl needed? She wasn't getting out of bed. She wasn't taking showers, wasn't changing her pads. Can I see in the chat what you guys think she may have needed? Okay, epi, dopamine. It's funny that you said dopamine. I'll explain why that's not the answer. Epi. So she needed the epi. She needs that arousal. She needs to be able to get up and do it. She can't feel reward from doing something if she never starts it. So we put her on a medication that had an increased neuroadrenergic tone. Big word for saying just more epi. And she was doing so much better in school, getting out of bed, cleaning herself because she needed more epi. Why it wasn't dopamine is because dopamine is like at the end, it's like the reward. That's what we give kids who are not focusing. We give them a huge shot of dopamine so they could sit down and then focus. So because they have that reward chemical floating around, they don't need to get up and self-stimulate, move around and be hyperactive. So that's kind of how I do it. So I have a lot of moms who come in that postpartum period. And remember, postpartum depression doesn't just stop at like a week or two after the kiddo. You could be a year out and then still have postpartum depression. And so I'll go through tell me what your day is like. Oh, I work from 7 in the morning to 5 at night. I come home and I do the dishes and I do that. And then I'm in school as well. You have no idea how many moms do this. And then they're just like, I don't know why I'm so tired. And I'm like, I'm tired just listening to your schedule. And then I could figure out, okay, if there needs to just be a social change, maybe you don't need any medication. Some of them are like, no, I need to finish this semester and I need to do it now. Okay, what ways can I support you in doing that? Let's see if there's a way that I could support you socially. I can find social supports in the school that you're going to. Or let's also put on some medication to help you in this season because you need it right now. You see what I'm saying? So you have to go to a good doctor who has like that kind of integrative approach, because you're not just biology. We are complex. Okay, so if you guys had specific questions about medications, I can talk about that. I'm just gonna do really quickly a general thing because I really want to get you.
Colette, can you tell them what I'm on and what it does and how it does it?
Okay, so Luvox. Okay, so this is how I kind of do. I have like this chart that I go over with patients, and it shows the tones of like whether it's like the epi, whether it's the dopamine, whether it's the serotonin, right? So how I knew that Jade would probably do well with this medication is because that is a medication that has a lot of serotonin, but it works well for an obsessive component. And one of the things that Jade was struggling with was those intrusive thoughts. And so I needed not just a medication that would help with her mood, but something that would be anti-obsessional as well. So those kind of medications would be like Prozac. Zoloft is one of those too, but it doesn't have the same balance as like the serotonin. So there are other anti-obsessional medications as well, but so Luvox is an antidepressant with anti-obsessional qualities. It's also called fluvoxamine. So I guess that could be a confusing part because you have brand names and generic names, but your doctor is going to know what is what. But I'll specifically go through that one. Let me see. Where's Luvox? Luvox here. Low sedation. So I might give a medication that has a side effect of high sedation to somebody who is not sleeping well. So for example, there is, I don't prescribe this a lot, but amitriptyline has high sedation. And so if I had a patient who had poor mood and wasn't sleeping well, I might give them that one and tell them to take it at night. I try to use the side effect profile of the medicine for the benefit of the patient. So if a patient is not eating, I'll give them a medication that might have the side effect of increased appetite. You see what I'm saying? So knowledge of these medications and what they cause, I kind of like hijack it and use it for what I want. So for Luvox, it has low sedation, low epinephrine. Okay, why does somebody who's anxious need low epi? You don't need to be aroused. And Luvox has 0. Right? You don't need to be aroused any more than what you already are. So that's another reason. And it has high serotonin and then no dopamine. Jade was fine in that area as far as like motivation and reward and like moving forward. I mean, Jade always does 65,000 things and she's moving forward all the time. So she didn't need any help in that department. So that's usually how I select medication. Yeah, very good, Latrice. I see. Yeah, because theirs is already high.
Exactly. Can you talk about the side effects? Because what did you tell me? And this is for everybody on the call who in the space who might be thinking about medication, but you're afraid. Let me tell you something. I was scared as hell. I was calling Colette like, I can't do this. The day before I was supposed to take it, I can't do it because I don't know what's going to happen. What if something happens? And she told me something very clear. If you're not going to the hospital, if it's not an emergency, go ahead and Colette, tell them what you told me.
Girl, I don't remember. I told you so much. I know that I told her to have return precautions already written out. I already knew that Jay was an anxious person. And so everything is going to feel like, this is it. This is the medicine. This is working. This, everything is going to feel crazy and overwhelming. So I said, okay, write it out. This is when I go to the hospital. Can I breathe? And then she sometimes tricks herself and says, I can't really breathe. And I'm like, Jade, you're talking to me. So I know you're breathing. You know what I'm saying? So you write it out beforehand. I do this to a lot of my patients. You have to have a vision, make it plain, write it out. Because when you're in a time of hyperarousal, you are not thinking clearly. If a lion is chasing you, you're not going to be able to do a calculus problem, right? So what you have to do, if you know that you have the propensity to be an anxious person, you need to write out your plans in a state of calm. And so in a state of calm, I told Jay, this write down when you know you're going to the hospital. And so every time she called me and said, okay, I think I'm going to the hospital, all I did was review those same things. Okay, is this happening? Is that happening? It's okay, you're fine. And as far as those side effects, you have to sometimes work through them. Your body has to adjust, because antidepressants aren't like a stimulant, like Ritalin. Like Ritalin, you get it, you feel it, it works. Xanax, you get it, you feel it, it works. These antidepressants actually have to get into your body on a cellular level and help your own body to manufacture and make certain things. So sometimes some of these medicines will help you to make more serotonin. Sometimes some of these medications will help your body to break down serotonin less, because some of our bodies have a problem and we just break it up. Our bodies will chop it up. But so some of these medicines work different ways, but they all increase the levels of the things that we need. But we have to, that's why it usually takes about 2 to 3 weeks to start working, because they have to get in your body on a cellular level and help your body to start manufacturing the proteins and things that it needs. And that's why you just kind of have to work through those side effects, because oddly enough, serotonin works well in your brain, but outside of your brain, like the place that has the most serotonin receptors is your gut. So a lot of times people have like GI, which means like tummy issues or things with that. But lots of those things are like things that you can work through. And then I always encourage people to talk to your doctor. I tell my patients all the time, we are a team. Work with me. If you're gaining weight or losing weight, talk to me. I'll figure something out. And that's how it is. It's like a symphony for me. Like, I'm like, okay, what's going? This is too high. This is too low. Okay, let's put on this. Let's take off that. Let's do a little bit of this. Let's change the time. It's not always adding medicine. Sometimes I say, take this medicine at night. Take this medicine in the daytime. Like, I work with my patients. And like I said, it's a symphony. It's cool. And I try to get the medicine to work well for them, so it can accomplish their goals, what they needed to accomplish.
I want to add something. So one of the side effects, I don't know if it's a direct side effect for everybody, but I've gained weight since I started Luvox. I don't know, I have. I spoke to my OBGYN about it, and we realized that the weight gain wasn't, how do you say this, Colette? Like the side effect wasn't, what do your doctors say? Like, the side effect wasn't worse than
the benefits. The benefits outweigh the side effect.
So since then, I have changed what I eat. I went to Sandy, who's on the call, changed what I eat. I take supplements and I work out. And right now it's kind of like the best time to work out, because we're at home and there are like all these free trainings. So I have lost weight since I started doing those things. So maybe I wasn't doing those things before and my heart was racing and I felt like I was losing weight after my baby, but the reality was I wasn't healthy in that space. So I'll take the extra pounds, work harder as far as diet, exercise, and things like that. But I feel like the benefits outweigh that side effect. I know we don't have too much time, Colette. I could literally listen to you all day. Because it's so helpful. But Marge, do you want to take it over to questions?
Sure. So there were a couple posts. I just have to scroll up. General questions. Yes, we will provide contact information for Dr. Colette Poole as well as Sandy, so you guys can reach out. I think there was one up. Someone had asked. Can everyone remain on mute?
While you're doing that, I'll just say,
Yep. Go ahead.
If you have any questions, you can send them in right now. This is our time for Q&A. So please, if you have any questions, send them in the chat.
Yeah. Okay. So first question. This is going to be for Dr. Colette. My depression lasted close to 2 years, prenatal and post, and she developed thyroiditis. What medication could I have been on?
Okay, so I want to say that, and I say this on my YouTube channel before I do a video. I am a doctor, but I'm not your doctor, so I don't have, I'm not privy to all the information that your doctor is privy to. So, so I can answer your question in general. So thyroiditis, so that's anything with itis means infection. So thyroiditis is an infection of the thyroid. So clearly her thyroid was under attack, and a lot of times the thyroid is implicated in depression because it produces things that the thyroid it does a lot. You can have depression, decreased appetite, dry skin, like all sorts of different things. And so sometimes we can give a supplement that like increases your thyroid function as well as an antidepressant. We give them both at the same time. So sometimes that happens. Or sometimes what you need to do is take care of the problem. And if the problem is the infection, work with the general medicine doctor to treat the infection. However, if the depression is so bad that you're not able to do anything, so we have this all the time. That's why psychiatrists work in a hospital as well, because sometimes the general conditions are the depression is so bad that they can't do anything for the general conditions. They have to call us, and then we'll have to tell them, okay, why don't you put this on this medication or do this in addition to what you're doing. So take care of the underlying medical issue first. Remember, we are 3 parts: bio, psycho, and social. Thyroiditis is gonna like impact you everywhere. So you need to make sure you take care of that first. If your depression is so bad that you're not able to take care of that, talk to the doctor who will refer you to a psychiatrist who can give you supplements. It's probably not a supplement, probably a thyroid medication and an antidepressant medication to work together. We do that a lot. So we don't just, usually it's not just one and done. Sometimes we put people on multiple things. I love magnesium, as Sandy said. I love it for multiple reasons. So I put people on multiple things.
Did she say thyroiditis?
Yes.
So yeah, can I intervene on that one just a little bit? Because of that, because I don't know what she was taking before, but that's because her thyroid is inflamed, and a lot of times it's hormonal. Because when after you have kids, or even when you're in that phase of having kids, they remember all of your hormones, which the doctor doesn't explain. They work together. And your ovaries speak to your brain, which will speak to the thyroid. And sometimes you can have an inflammation in the thyroid gland. I don't know if that inflammation caused you to have an underactive or an overactive thyroid, but you should find out if that inflammation, what the implications are, if it's causing you to have an underactive thyroid. Because if your thyroid is not as active as it should be because of the hormones, it could be a direct relationship with your estrogen, all of those other things that happen once you have kids. So I mean, yeah, I work in that space. I work with with PCOS and a lot of other things that happen after you have kids. But that's not that it's not uncommon, but sometimes that happens as a result of maybe having too much estrogen and the off balance with the progesterone and estrogen. I just wanted to add that in, make sure you have that conversation to find out exactly what that means, because it's just a blanket. It's like saying that your skin is red, but you don't know why. If your thyroid is inflamed, you should find out if it's because it's underactive, why there's an inflammation in your thyroid gland. I just wanted to add that because, it may not, like, Dr. Colette says, it definitely all goes together, and it may not be anything that, you really need to worry about. And it's something that will probably resolve itself once you, find out exactly what's causing it.
Thank you, Sandy. Thanks for adding that in. We're going to hang out here for about 10 more minutes because there are more questions coming in. So the next one, Jade, is actually for you. Was your anxiety brought on by childbirth, or was it present before?
Okay, so these are my friends. I just have wonderful friends who do wonderful things. And if you know me, I'm an anxious person. Like Colette said, she already knew. Colette and I went to high school together, okay? So she already knew that I was a hyper person. I've had anxiety my whole life, specifically hypochondria, which is like, I'm always thinking something's wrong with me medically. I was able to maintain before my baby, because I went to acupuncture every week for 7 years. I was Ayurvedic. I'm a yoga instructor. I would go on retreats. I would go away. Like, I did all of these things to manage my anxiety. But I couldn't do that anymore when I became a mom. I can't just get on the plane with Marge and go to Puerto Rico like we used to. I can't just say, okay, like after work, I'm going to go to acupuncture. My schedule's different. You know, I have to pick up the baby. I have to get home. I have to do all these things. And so I no longer have that time for that leisure, because I do believe that the other space works. So I do believe that integrative and holistic medication works, but there is a time commitment to those things that mothers do not have sometimes. That's why the combination of both things works for me. So after I had my daughter, I realized, oh my God, yes, my anxiety is worse. I've always had anxiety. Now it's worse. I used to see a therapist before. I've never seen a psychiatrist until I had my daughter. And I said, oh my God, I cannot function. I used to be able to function. Now I can't. So it was like that sparked something inside my body, me having my daughter, where it was like, this has been a problem that you've been able to manage. And it was expensive to manage beforehand without medication. But now, no, this problem is way bigger and you need to get it together. I will tell you honestly, I wish I would have been on this medication before my daughter, because it would have helped me. I feel like things would have been easier for me. I hope that answers the question.
I like what you said, Jade. Like you said before, you were able to manage it. And I think that us as women, especially Black women, we need to understand that we are used to balancing a lot of things. And so when we start to be impaired because of our mood, we feel like, okay, what's wrong with me? I should be able to balance more. No, that's not true. And that is why when I have like patients and I figure out what's going on with their schedule, they'll tell me, no, I cannot change this. I still need to finish. I need to get my master's degree. I need to get my bachelor's degree, but I still need to take care of my child. And I'm still dealing with this husband that that things are on the fence. And I'm like, okay, what can we change? We can't change much. Okay, boom. If I give you a little bit more epi, I put you in therapy, boom, you can manage it a little bit more. Now you have a little bit more motivation, a little bit more energy. You're sleeping better. You're motivated to exercise. So don't feel bad if you can't balance everything. We weren't made to carry everything on our own. It's going to get to a point in time when, as you start adding children, you have 2, now you have 3. Now you have a job. Now you have a job with a boss that is doing, extra stuff, making you do extra work, or now the husband is doing this. There's going to be times where you're like, okay. And my therapist told me, she said, just because you can handle things doesn't mean you should always take it on. And I was just like, I have an advanced degree. And that was just like mind blowing. Like, you really mean that I don't have to just carry stuff just to carry it? Like she was, and she's a white woman. She was looking at me like, you have a lot going on. Like, what are you doing? Like, what are you building, an orphanage now? Like, what are you doing? Like, I'm always doing things, trying to help the world. And she's like, all right, stop. Just because you can doesn't mean you have to.
Awesome, Dr. Colette, thank you. Jade, a follow-up question to you, and there's still some additional questions that we can get to, but someone is asking how many months out are you postpartum, because their story, they can relate to your story, it kind of mirrors their own. So how old is Bean?
Bean, my daughter's her nickname is Bean. She will be 2.5 next month. So you know my math. What is that, 29 months? 24, 29?
That would be 30. It would be 30. So 30 months.
Listen, I've never been good at math. So I'm 30 months postpartum. My daughter is 2.5, and many things have changed for me. But I want to have full transparency with you guys. I am still on my medication. Yes, I am, and I'm very happy. So yeah, 30 months.
Okay, awesome. Thanks. All right. Okay, wait. There's a lot of questions. Work with me, guys. Are there medications that are safe while breastfeeding? So for the nursing moms that are experiencing extreme mental stress and want to consider medication. Dr. Colette?
So the answer in short is yes. And I've actually specifically in one of the clinics where I did my residency at in Texas, I asked specifically to see pregnant moms. So I saw pregnant moms, I saw postpartum moms, and I work with them. Think about what Jade said, risk versus benefit. I had patients who literally, I think I mentioned this in one of the She Matters events. If she was not on her Seroquel, and that's an antipsychotic, she was either stabbing her boyfriend in jail or what, she needed to be on it. And so it didn't really matter for her to carry through and finish this pregnancy, she needed to be on it. We would deal with everything later. But that's just me letting you know it is okay to take care of yourself. And if something works for you, and this is the only thing that works for you, talk to the doctor, your OB, and your psychiatrist together, and they can make a decision to continue things that may not even be as safe in pregnancy, but they will help you and support you throughout the pregnancy to make sure it's as safe as possible. But to answer your question, yes, there are safe medications. In the anti-anxiety batch of medicines, there are safe medications. In the antidepressant and in the antipsychotic range, there is no need for moms to suffer through pregnancy and breastfeeding because you need a whole lot of support. Your mind needs to be right during those times.
Thank you, Dr. Colette. One more for you, or maybe there's a couple more. What medication do you recommend to start women off with who are suffering from depressive symptoms only?
So I don't have a go-to in my head. Like I don't care how many times like pharmaceutical reps come to the office, bring breakfast, lunch, dinner, whatever. Like I don't have one that just pops in my mind that I love and I always start. I always go to my assessment of the patient. I look at their biopsychosocial. And then since I have knowledge of the medication, I'll figure out what I think this patient needs. So I don't have a go-to, even if it's just depressive symptoms. There's something in your psychological or social or whatever that is going to give me more information. Okay, I'll give you an example. Zoloft. I use Zoloft and people who may have some personality issues, some interpersonal drama. They're, very, very, very reactive, because I had a lot of people who tell me that Zoloft makes them emotionally blunt. Like they'll be sitting like this. I really feel like crying right now, but I can't. So I use that emotional blunting side effect for those people who are way over the top and who need to be blunted to be normal. So there's something in your story that would tell me a medication that would work best for you. So I don't have, like I said, a go-to medicine.
Thanks, Dr. Colette. And last one. So as I'm reading all these questions and the questions are coming in for, asking your thoughts about different medications and things like that, can you just spend maybe a minute stressing the importance of comprehensive consultations and, whatever we're talking about in the chat and, replying to these questions, should be discussed with their primary care providers.
Yes. So like, as I said at the beginning, like I am a doctor, but I'm not your doctor, and you have to find one. The reason why is because you need that relationship. So, there's something that I learned in medical school. I heard this somewhere. It says that, like medicine doctors heal with pills, surgeons heal with steel, like the scalpel steel, and then psychiatrists heal with relationships. So you need a good psychiatrist because you need a relationship with somebody, because you're going to be open. You're going to tell them things that you have never told anybody. People come into my office and they will sit there and they'll be like, we have a good relationship. We'll talk day in, day out, or whatever. And it finally comes to a point where they're like, okay, I've been eating tissue for 5 years. And then I'm like, oh, okay. All right. And then they're like, and sand, and I'm spraying, hairspray in my mouth, and this, and, so like, And that's going to be completely different than someone else who comes in my office has a different secret. That's why it's important for you to get your own provider, have a good relationship with that provider so they can make a plan that's specialized to you. I could give you some education about things, but because I don't know you personally, I'm not going to have that specialized plan. And that's what you need. And you have like these wonderful people, Jade and Marge and Sandy, who are offering time to connect you with people who may even look like you that you can feel more confident in. Because like I said in the last session, I've had patients where it'd be me and the entire group, and let's say I'm the only Black doctor, and then the other doctors leave the room, and then they look at me and they're like, okay, doc, what happened? Like, explain everything. I'm like, yo, dog, this whole time you had questions and you weren't asking them, but what can we do? There's distrust and, with the medical community from, Black patients, and that's just, I mean, it's true. The history of this country, the social climate now, I mean, of course there's some distrust, but you need to have a good relationship with somebody so somebody can break down your biopsychosocial. You cannot do that yourself. You can't do that alone because you need somebody on the outside looking in, especially if depression or anxiety or trauma or thought disorder is clouding your thinking. You can't do that on your own.
Thank you so much. If I can ask Dr. Colette and Sandy if you have a website or social media handles for our participants to get in touch with you, if you can just put that information in the chat. We had some questions about that earlier. Would really appreciate it. I think I got through all the questions. Perhaps I missed one. Okay, okay, two more. Dr. Colette, what would you recommend for feeling traumatized related to your birthing experience?
Oh, I quickly typed a response, but
Okay.
it didn't. But like, I actually had a patient who, and this is one of my success stories. She came in and her birthing experience was awful. Like something happened where she couldn't see her baby. They said that maybe she had like a pulmonary embolism or something. So anyway, she had the baby and then they whisked her away to surgery. No, she was positive for some infection. They whisked her away to surgery and wouldn't let her see the baby. So it wasn't until 5 days until after she gave birth was she able to actually meet the baby. There's a lot of like oxytocin, that's a hormone, that's a bonding hormone that's released when you're having an orgasm because it's a connecting hormone. And it's also released when you're expressing milk for the baby. It's a bonding hormone, it's a bonding chemical. So there's lots of bonding and things that she missed out on. And so she was terrified of getting pregnant again. Her and I talked about it. We made a plan. I reached out to her OB, and then we sat down and made a list of questions for her to ask the OB. She came back and she was like, I'm not terrified anymore. Like me and my husband are talking about finally having another baby. It was really sad that she had to come to a psychiatrist in order to just feel free to ask the OB questions, but she really didn't understand why she had been taken away. Long story short, it was just a very traumatizing experience. How you get through the trauma, you talk to somebody about it, you get control over the things that you have control over. So for example, if it was an infection or something, make sure you take medications or supplements to make sure that your body is healthy or strong, or avoid whatever gave you the infection in the first place. I really can't remember what it was, but it was such a bad experience for her. But take control, talk to somebody, and then don't let that stop you. Like I said, that particular patient, her and her husband moved on and they were working on their second child after she came to see me.
Thank you so much, Dr. Colette. So for everyone that registered for the event, you guys will get a thank you email that has just some information on what we're going to be focusing on next. And there is also a link to a survey. I will pass it over to Jade to close us out.
Thank you so much. This discussion has been amazing. This is like my vision coming to life. Black women healing other Black women. I am fortunate that I have these amazing women in my life, and I've been able to utilize them in a way where I've been able to get healthy on my journey. I'm gonna let you all know that this is a journey. there is no endpoint. Mental wellness is something that we all have to maintain throughout our lives. In order to help you guys, in order to help our community, it's important that you guys do the surveys. It helps us get funding, it helps us for many reasons, but the most important thing is it helps us help you. So please, when you get the survey, respond to it. In addition to that, we are going to have a workshop. Please look out for the email. Now, the workshop will cost, but we are taking time from these medical practitioners, and it'll be at a staggered cost. So just look out for the email about the workshop. Look out for the email about the survey. You can always email us at info@shematters.io. That will be in the email. But I just thank you. And I thank you for participating. I thank you for listening. I thank you for being open to this step in your journey and this step in your healing. Again, thank you, Marge. Thank you, Dr. Colette. Thank you, Sandy. Thank you, Melissa, who's also on the call. I appreciate you guys so much. And we'll see you next time.
Yes, one last thing, because some other questions are coming in. We will be making the recordings of part 1, 2, and 3 available on our website. We're working behind the scenes on that, and we will send out an email as soon as they're live on our site. So please make sure you look out for our emails, make sure they're not going into spam, because that's how you'll find out about that. Thank you so much, everyone. Enjoy the rest of your afternoon and
Enjoy
weekend.
the Memorial Day weekend. Social distancing, everybody. Bye.
Bye.